I'm a retina specialist, and retina specialists take care of obviously things pertaining to the retina, which includes a lot of maybe more severe, more chronic diseases, things like diabetes, macular degeneration. We deal with a lot of surgical things like retinal detachments, trauma. A lot of times retina guys get involved if there's trauma, particularly if it's in the back of the eye. And I'd say primarily over the past maybe decade or so, because of some advances made in treating wet macular degeneration in particular, our practice patient population or dynamics have somewhat changed in that we're taking care of a lot more macular degeneration patients. I was into photography as maybe a teenager and through college. I did a lot of wildlife photography, but essentially kind of hunt with a camera. And the eye is the ultimate camera. And I was also a little bit of a techno person. I liked technical stuff. And retina entails a lot of high-tech stuff. And I rotated through ophthalmology in medical school. And in medical school, you're taught to look into the eye with something called a direct ophthalmoscope. That's that instrument where you're looking at somebody's eye and it's almost like you're kissing them. You get real up close to them. You're having a doctor do that to you. You can't see a whole lot with that instrument. And when I was rotating through ophthalmology for the first time, I had a piece of equipment that let me look at the back of the eye in a much better way than I had previously in med school. And when I saw the retina for the first time, I was like, this is neat. That's what I want to take care of. It's very intricate. There are little blood vessels and little nerves, and so many diseases like, for instance, diabetes and high blood pressure and a myriad of other things affect little blood vessels and little nerves within the body. And so the eye, because the front of the eye is usually clear, affords us a view of those little blood vessels and the little nerves, and those little blood vessels and the nerves are the retina. And so we can a lot of times diagnose things that aren't necessarily pertaining directly to the eye. In other words, systemic diseases by looking in the eye. Pretty much to just treat a patient as if they were a family member, and I pride myself on explaining things because a lot of the things that we take care of, quite frankly, are more chronic things for which we don't always have a perfect fix. And so that's one thing that distinguishes retina a little bit from, like, say, doing cataract surgery or something, where the patient's, the problem needs treatment that's ongoing. For instance, with macular degeneration, we have patients coming in once a month sometimes to get treatment. And if you, at the onset of that, explain things to people explicitly, but in a way that they also understand, so that they, well, when you have a chronic problem, understanding what's happening a lot of times is half the battle, and it makes being treated for that problem and understanding what you can and can't expect, it helps some. And so I pride myself on explaining things. I really love my patients, and so this morning I was operating on a guy who I've known for years, and he has a chronic problem. He's diabetic, but he and I are very close, and because I've been treating him for years, and I get to meet people from all walks of life, and old and young, and with a variety of different diseases, and that has been a unique privilege, and I'm sure it's something that most physicians enjoy about their job, but in retina in particular, you get to kind of keep seeing the people. If they're coming in once a month to get treatment, or in the case of like a diabetic, maybe coming in every several months, you get to know people.